5 and we have people there. So let's start. I will start with my introduction. I'm Dr. Madiha Sarwat. I have done my FCPS Pediatrics 3 years ago and I have completed my MRCPCH last year. And I'm currently working in developmental pediatrics at Children's Hospital Lahore. Today, the topic of our webinar is going to be on history taking in a case of diabetes mellitus. In this scenario, we'll be discussing how the case have presented in different recalls. And since you know that history taking and development, they are two of the longest stations. So is anyone familiar that how much time do you have? So this is the division of time. You have 13 minutes overall to take history and 9 minutes for the Viva. Those 13 minutes are divided in 9 minutes during history, and then you are given a warning that only 4 minutes are left. So you should be very well aware that you have last 4 minutes for closing the points and for summarizing in your mind and also for coming up with a differential diagnosis. So this is very important in case of MRCPCH since you will be doing it with a role player and not an actual patient. Also, you would have to cover a lot of things that you see in other patients in case of real patients. So you have to be very smart with your history taking, and nobody expects you to take a very huge history. It's a focused history. So it's very much practice based. How much you are only going to get better with practice of all the recall scenarios that you can get. And because 13 minutes is a very short time for a detailed history. So I will try to keep the webinar as interactive as possible since most of the people who are appearing for this exam have already given written exams or given FCPS. So we'd try to keep it interactive so that everybody stays awake. So can someone tell me, let's start with the general points. What are the main components of a pediatric history that you are expected to take in MRCPCH or in any exam for that matter?
Okay, can I answer?
Yes, sure. Dr. Ikra.
Yes, my name is Dr. Ikra, and we start with the personal profile. We ask the personal details of the patient, like how old is
Okay.
he and something like that. And then we proceed with the presenting complaint. What are the presenting complaints of the patient? Then we go to the history of presenting complaints, like we elaborate it in detail. And then
Yes,
go
good.
into the past, and in that we cover everything, like causes, like complications, like treatment they had been getting and something like that. And then after that, past medical and past surgical history, and then
Okay.
developmental history if applicable. It depends upon the age of the child, if it is relevant. Birth history we take, then schooling history, allergy history, family history, drug and allergy history you can take together. And yeah, that's it.
Okay. And would you like to add something with someone else? Thank you, Dr. Ikra, for your reply. Can someone else add if we are talking to a teenager? Is there any other point in history that you would like to ask?
Then we'll ask for pubertal history,
Yes, good.
and psychosocial history will be important in a teenager, schooling, education, what is
Yes,
the relationship
good.
with the peers, fighting with the group or not.
Yes,
These are all important
yes.
things.
Very good. Very good. Dr. Uzma, is that you? That's you answering?
Yes, I'm Dr. Osman.
Okay, okay, thank you. Yes, very good insight. So I would like to open my slide where there are the components given. So yes, these are the components of any pediatric history. You start with the personal profile, then presenting complaint. So like any other history in diabetic history, you have to be very clear what is the presenting complaint. So for your presenting complaint, I most commonly your presenting complaint will also be written in the summary given outside. Usually the summary is one sentence long And you have to be very mindful of the name of the patient and whoever is giving the history, and what are the complaints that are written on that paper. Ideally, you should make your map that one of those complaints is going to be your presenting complaint, and the other two you would get from the history given by the parent or by the patient himself, whoever the actor is pretending to be. And then it is for presenting complaint, you have to follow the same order. It has to be in chronological order. They should not be more than three. They should be very relevant to your diagnosis and your list of problems, so that your history is leading to the summary from very early on. Then, history of present illness. The history of present illness will obviously be a detailed review of all three presenting complaints, whatever is the current status of the child, and it will also include review of the other systems. So in MRCPCH, they have written that it has to be a focused history. At the same time, you have to cover everything. So it is better to follow your own skeleton of history that you have for reviewing different systems, so that you don't skip anything. But if a system looks very irrelevant, then maybe you can skip it. It only comes with practice. When you practice with your peers, then you will know that how can you defend every system that you have asked for. In past history, different people have different ways of telling the history of present illness. Some people will cover in the history of present illness. Am I audible?
Yes, yes, very clear. But your screen just lost.
Okay. Am I audible? Let me reshare my
Yes.
screen. There was an internet issue at my end. Okay. Is my screen visible now?
Yes, you're audible and the screen is also visible now.
Okay, great. So, yes, I was talking about the past history. So, in diabetes, it is a little like every other chronic illness. It depends on your own choice where you want to put the time of the history at the time of diagnosis. How was he diagnosed? Who diagnosed it? What were the symptoms? What medication was prescribed? Has it changed over time or has it not changed over time? So it depends how you practice and whatever style you are comfortable with. It has to look coherent. There is no fixed routine that you are supposed to follow, but one thing should lead to another. It should look like you are taking a history like you do in routine. So that can only be done with more practice. So, as far as past history is concerned, it can either, if you have not already talked about the history at the time of diagnosis, then do talk about it. The second thing is the admissions. All the admissions that the child has had, and for what complaints? What were the main complaints that he or she was admitted for? Was it always diabetic ketoacidosis? Was it always hypoglycemia? Was it always an intercurrent infection? So you have to know and always give description of the longest admission and what were the events leading to it and what change in treatment had happened. Then birth history, it's not very, in case of diabetes mellitus, you can keep it very short and very pertinent. Immunization, sure. You can again keep it very short. Then nutrition. Nutrition is very, very, very important. It should start with the current nutrition and whatever the child is taking, and what is his routine, what is his knowledge, what does he know about the use of insulin around food, and how does he modify his insulin in relation to food? Is he aware that he can modify his insulin? All those things. And in this, different historians take put alcohol in different portions. I usually keep it around the nutrition point. Is the child taking alcohol or not? And is he aware of its side effects and its side effects on his glucose control and in general? Do ask about it, but very, very empathetically. You have to stay empathetic throughout the history, no matter what you're asking. Growth and developmental history, basically, you have to focus on the growth. That if the child has had diabetes since the age of 3, 4 years, and now he's a teenager, and as we all know, that if the control is not good, he's not going to grow well. So you can ask in history is that is he aware of the growth charts, and has his growth been the same as his peers? Then, like Dr. Uzma said in detail, in social history, we would ask about if there is a teenager. Then we have to ask about this heads. Heads is, does anyone know what does heads stand for? Can someone tell me?
Hello.
Uh, Hello.
Hello, this is Dr. Safa.
Hello, yes, Dr. Safa, you can answer.
Okay, so H stands for home, E for education, school attendance, A for activities and peering with, activities and relationship with peers and friends, D for drugs, and S for societal attempts, and the other S for I don't know.
Okay. Thank you so much, Dr. Safa. Yes, you are correct. So there are two S, basically. I had written one by mistake. Two S, one of them is for sexuality and one is for suicide depression. In home, you have to ask who lives at home and how is the relationship with everyone at home, and how is the parents' relationship. Have they ever had any move? Has he ever run away from home? What about education? Education is very important. You can ask about the school environment and how is he doing at school? How many times has he had to miss school? And what is his relationship with peers at school? And any what is the relationship with teachers, and what about everybody who is there at school or related to education? What is their knowledge of his condition, and what kind of acceptance does he have, or is he facing bullying or any kind of mockery at school? So that is very important to ask, but very carefully and very empathetically. At the same time, activities, obviously, you have to ask what is his sleep routine? What is the stress in his life like? Is he playing any sports? And what other activities? How much TV? What is he sedentary? How much TV is he watching? And does he have any other problematic signs like has he had any social disruptions? Has he been the cause of any social disruptions for which he might have been arrested, or uh, is he like in the same thing like suicide and depression? You can ask that does he get bored very often, and does he have any history of withdrawal, isolation, and does he feel isolated from his peers because of his illness? And sexuality is a very you can ask about it in very um, modest kind of way. Like you can ask, do you have a partner? If you don't, you can just say, if you don't mind me asking, do you have a partner? And then you can ask that if it's a female, most likely, then you can ask if they are aware of and what is the partner's impression of the illness, and is he aware of any emergencies or contraception, you can ask, since children should know in case child the mother is diabetic, there are some problems that can occur in the infant. So you can ask, check that knowledge if it comes to that. Otherwise, the role player will lead you to the history of whatever problem you have to focus on. So what are the common complaints that the child comes with? Let me see. So these are the possible scenarios that you can be facing. It can be an acute history. That is, the child may be coming for the very first time. Like you have a scenario of polydipsia and polyuria, but the family is unaware of the diagnosis. There, in this case, you would be expected to make a list of differential diagnoses. However, the scenario might say that the child has polyuria and polydipsia, but the child is a known diabetic. When you go inside, the parent will tell you that my child is drinking a lot of water and he is peeing a lot. And then you ask, okay, does your child have any problem previously? He will say, yes, he has diabetes since the age of. So be mentally prepared for this. Both things can occur. So, and if sometimes in the scenario, they might have mentioned that the child has this, like he's a known case of diabetes mellitus, and he has now presented with the history of fainting twice in the last 1 month. Talk to the mother. Then, most likely, you have to think of the problems that might lead to fainting. Is the child having hypoglycemia? Is the child going through diabetic ketoacidosis? Or is there any other problem? So you have to think like that. Then, can someone tell me, how would you, in a case of chronic illness like diabetes mellitus, what are the main components that you would like to cover in your history of present illness? Someone, anyone? What would
Polyuria
you
and
like?
nighttime awakenings due to
Okay, okay.
Reason this time for coming. What is the concern this time acutely? Whether
Okay,
it is
great.
hypoglycemia or he has got an infection which has got change, due to which there are changes in blood sugars, or whether he has presented in with DK in the ER, or he just came for a regular visit and the blood sugars were high and now he is admitted to change the regime or to see what is the cause. What is the acute
Yes.
reason to come here?
Okay, great. Yes. And anything else you would like to know in the history of present illness? Yes, Dr.
The
Aisha in
compliance,
compliance. Okay.
the
Dr. Aisha in
dosage,
comments
recent
is
changes
saying,
in the dosage.
okay, great. Hypoglycemia attacks and number of admissions. Good. Next. Anyone else?
It's important to know who administers the drug. Does the
Yes, it's
child
very
take it
important.
himself,
Yes.
or it is someone
Yes.
else who administers? And does the
Yes.
child knows how to use it, and does he routinely rotate the sites? Are there any
Yes.
changes seen in the skin? That is important. Then it's important to also ask when was the last glycosylated hemoglobin or the blood sugars, when was it last checked? When were
Yes,
the
that is very
doses
important.
adjusted? And also regarding the control, since when if the patient comes because of poorly controlled diabetes. So these are the things we need to ask to the patient.
Okay, great. Yes,
And
thank you.
also, whether there is a record, does he have a diary where he is recording all the blood sugar so that we can follow
Yes,
for the
perfect.
last
Thank you,
1 month
Dr.
how
Usma.
many?
Yes, the diary is very important in this case. Whichever disease needs monitoring, you have to ask for a diary. Okay, so we will basically divide our history of present illness into three categories, into three main headings. So that's what I do so that I don't miss any points. So you will ask, I always start in the chronological order. Like what happened at the time of initial diagnosis? Why did they go to the hospital? What were the initial symptoms? And then was there polydipsia, polyuria, weight loss, polyphagia? Then you should ask if they had ketoacidosis or not. And then how was the diagnosis made? What tests were done? And how much education have parents received during that time? And what was the treatment in the hospital? And what treatment was started at the time of discharge? And after that, you need to know what was the progress of disease from that time to this time. So now there are two ways of doing it. Like history of present illness can either start with the current status, which was your presenting complaint, and you can go in detail of the current status first and then go on these two scenarios. But also you can also start with the initial diagnosis, then progress of the disease, and then elaborate the current status. But whenever you're taking history of present illness, you always start, you ask the parent, okay, you have told me this happened, and this happened. Can you tell me in detail how this all occurred? Now, the role player will be very trained to answer the questions in a way that they want to elaborate. So pay attention to whatever they are saying. On a paper, always make a column for history of present illness, and on the side, write all names of all the systems that you need to cover. And any leading questions. You will be given 4 minutes outside the room to make this skeleton. Uh, the better your skeleton is, the better will be your history because you have very short time. So you can start if the role player wants to start with the current status and all their problems are lying within the current status, then start your history of present illness over there. You have to be a little flexible over there. So in current status, you would like to know the details of the presenting complaints. In addition to that, you should ask what is the general health of the child like, and what kind of drugs is he on? Like, what type of insulin is he taking? What is the dose? What is the regimen? Who is administering it? Who is storing it? How do you store it? Do you know about rotation of sites? Do you know about any complications? Then, when you talk about complications, that's where your systemic review comes in. Then you can ask about any complications that he has had, like is he do they monitor the glucose, and has he had any fainting attacks, and do you think that he can adjust it for normal eating, and how often, if he does have hypoglycemia or hyperglycemia, how often does he have it, and what do they know about managing it? And the next thing that you need to focus on, like I'd like to go back onto the components. So history of present illness is very important. We covered past history, like previous admissions that you need to ask about. They are also very important. What about nutrition? What would you like to ask in nutrition in a child who has diabetes mellitus?
Is the child or the parents aware of food that has low glycemic index? And do they
Okay.
adhere do they adhere
Yes.
to, are they in touch with
Yes.
the dietitian? And do they
Yes.
adhere
Very
to the
good.
diet? Do they adhere to the diet? And we
Okay.
also need to ask the parents whether they are aware of the child's growth chart and whether he's following his centiles. What has the GP told him
Okay.
about his growth? And regarding
Okay.
loss of weight, we can also ask how the mother realized that the child was losing weight. Was it that his clothes were getting loose, or was it the GP who told her about it? Something like that.
Okay. Good. Someone else wants to add something?
So, Assalamu alaikum, doctor. I was telling that
Welcome.
we should also ask if they have knowledge about, if the child is on pump, then at least the parents are aware of carb counting or something, like.
Okay. Yes.
And also the
So
diabetic
basically,
diet.
diabetic diet, yes. So whenever we talk about nutrition, the first thing that we need to know is what is the child actually taking? We have checked, uh, we will also check for all the points that you have mentioned, yes. But the first thing that comes to the question that arises is what is the child's nutrition like? What does he eat in a normal day? So, in terms of dietetics, we say 24 hours recall. What does the child take in the has taken in the last 24 hours? And what is the sugar monitoring like? And also in nutrition, we would like to know, although we can check for activity in social history as well, but in nutrition, we can also ask if he's taking so many calories, is he aware of balancing it out with either increasing the insulin dose or with activity? What about and the nutrition? Like someone pointed out, that a dietitian has to be involved in the care. What is the follow up like? And is the child actually following all those diet charts? And what about the growth charts? And how many times has his HbA1c been done? And has it been appropriate for his care? And what else do they know about low glycemic index foods? And what is the child's preference? Is he struggling? What about his relationship with food? What if the child is a teenager and he thinks that insulin is making him fat? Is he really taking it, or is he losing weight recently? All these things have to be asked very clearly, because usually the diabetic scenario will be a diagnosed case and a teenager who is going through puberty. So, like through puberty, you have to give more insulin, while the child is also going through a negative body image and negative self image, and the compliance is poor, and peers are taking alcohol. So, all these problems have to be addressed together. So, the one trick that works in exams is you have to listen to what the role player is saying, and be very careful, because they have learned all the expressions and all the emphasis points. So you should pay attention wherever they are trying to give emphasis. Sometimes we have a very good skeleton in mind, but the role player is not emphasizing on that. So first of all, pay attention to what the role player is saying, and then focus on that point, and then go to the next one. Do not dismiss the role player. It is very important in history to stay empathetic and stay focused. So let the role player lead your history. I will keep repeating it, because no matter how many books we read, how many webinars we take or classes we take, until and unless we learn to listen, we won't be able to take the right history. So focus on what the role player is saying while following your own scheme. So in social history, what does the school need to know? Can someone tell me?
Yes,
The
school
school
knows.
nurse needs to be trained. The school nurse needs to be trained in dealing with an emergency, in a crash situation, in a child with diabetes. First of all, they should be properly trained and taught about it. Then the child should be aware of it, and should seek help when necessary. And also, we need to ask what is the reaction of the peer group of the child. Does the child take his insulin shots in school? And if so, where and how? And is the school supportive? And are the friends supportive? And does the child face any bully issues? Is he embarrassed taking his doses at school? And what about the tiffin food? Does he carry from home? Or is the proper diet provided in school? All these things can be.
Yes, very good, Dr. Priyanuj. Is that how you pronounce it? Okay. So, yes, the school nurse has to be aware of his condition and what is the acceptance of the teachers and the peers. And insulin, what regimen is he on? Is the regimen allowing him to be carefree in school, or does he have to take some insulin during his school hours? And if so, where does he store his insulin? And how does he give it? Does he have to skip class? Does he have to go out and do it? And how does it make him feel? Because that is very important to know, that if all these things are bothering him or not. Sometimes if they are not a problem, then the parent will tell you that he is not bothered by it, he does it every time. But sometimes that will be the main concern, that the child is skipping his insulin because he feels very embarrassed that he has this disease, or because he thinks that other people make fun of him when he has to get out of the class, or they isolate him because he is carrying from home while other people are eating from the canteen. And is the school administration on board about his dietary requirements? So all these things are very important to ask. What about the home environment? Can someone else? What would you like to know in the home environment in a child who has diabetes or any chronic condition?
First, the family dynamics, ma'am. Are there any stresses at home? And how does the child feel left out, or his relation with his sibling, if he has any sibling? And other than that, you can also ask about the family's financial condition, how they are able to cope with this condition, cope both financially and emotionally for the parents, because a lot of adjustments have to be made in the family uh, because of this diagnosis. And how is the other sibling reacting to it? And about the parents' mental health, if they have required any psychological help, respite care, and are they have they joined any support groups where they meet other parents? Or if it's a teenager child, then he could be associated with some support groups where children of same age deal with their situation, that could help him. All these things we can ask. You can also ask of the history of similar illness in the family. If similar illness has been detected in other members, and also how they were treated, whether with drugs or with insulin. Maturity onset diabetes of young is a condition which has a strong genetic component. That also we can ask, but usually insulin is not required for MODY.
Sorry for the interruption. I have requested to share my screen. Let me see. Yes, we were talking about. So we were talking about the home component, that who can someone tell me what would you like to know about the home environment in a patient who has diabetes mellitus?
Okay, we can ask the psychosocial impact of the social and the financial impact of the child's disease on the entire family, like how other siblings are dealing, how the
Ma'am, we
parents
can
are dealing.
ask Dr. Madiha, we can ask like what home
Yes, in
modifications
home
have you
environment,
done for the
so I can't
child?
hear you.
We can ask about any changes because this is a chronic illness. Has any changes in the home been made or any dietary changes that have been made so that the child doesn't feel odd one out, I think.
Okay. Okay. So yes, you can ask about other things like what is the relation, what is the stress at home like? And since it's a chronic illness, the child is getting a lot of attention from the parents. Is there any sibling rivalry? And what about any recent move? And what do they do when they are traveling? Because insulin has to be taken at a certain pattern every single day. So in home environment, you need to know all these things. And what happens if there are guests over? How does he cope? And also, in the same thing, you can ask that do they know the whole family? Are they on board with the illness? And do they know about any support groups? Because support groups play a major role in a chronic illness. So the child will be able to attend the support group with the parent initially, and then when he grows up on his own, and it's easier to relate to people who are going through the same problem instead of with the doctors or the staff. And what about the education of the family about the disease? Okay, the child and the one parent who is the caregiver, they know a lot about the disease because they have been going to the diabetic clinic, they have been going to all follow-up visits. But what about rest of the family? Do they all know that what is the child going to need in case he falls ill? And are they aware of the sick day management or any how what to do in a case of hypoglycemia when the child has fainted? So that is very important to know. In the same way, activities, the children since all the strenuous sports, they burn a lot of calories. And at the same dose of insulin, the child may start experiencing hypoglycemia. So you should ask, has if a patient has presented with hypoglycemia, you should ask if he has recently started any activity that was not being done previously. And Has any follow-up visit been done after the child has experienced these episodes? And then you should ask about any symptoms that have occurred recently. Like you can ask about seizures. Um Hypoglycemic seizures can be common. Sometimes you will be given a scenario where a diabetic child has presented with a seizure, and when his sugar was checked, it was hypoglycemic. In history, you would find out that he has either started skipping meals, started using insulin a lot more than the requirement, or has started a sport recently without a change in the insulin levels, and he has not been monitoring. So all these things have to be asked in the history. Apart from this, so like I said, we have talked about the possible scenarios and how do you manage time. So first 9 minutes, you have to keep it open-ended, you have to be slow, you have to be very empathetic. You have to stay empathetic throughout. And the first thing you need to know is that when you're given the warning of 4 minutes, there'll be a knock on the door, or someone will say 4 minutes left. Then you need to go towards winding up, as well as making a mental list of your diagnosis and the problems. Because the questions that you're going to get in the Viva are all set questions. First of all, you would be asked, so um, tell your history, summarize your history, or and then what is your differential diagnosis? Then you will say, or what do you think is wrong with the child? One way or the other, they will ask you about the primary diagnosis and the problems that he has. Then they will ask you, how will you investigate this child? Then you have to tell all the investigations to you will not be obviously reconfirming the diagnosis, but you have to tell all the investigations that are needed for monitoring, and also the investigations needed for checking for the complications, and all the concurrent diseases like hypothyroidism if it hasn't already been done. A good way to say this is that I would like to review all his medical records, and after doing a thorough physical examination, I would offer him this list of investigations. All the investigations are given in the guidelines books. You have to go accordingly, according to the age of the child, according to the time since the diagnosis has occurred. And then you will be asked about the management. The best way to open a sentence about management is you can say that since it's a chronic illness, or since it is a multi it needs a multidisciplinary approach. First of all, enlist all the people you would like to involve, like yourself as a pediatrician, an endocrinologist, a diabetic nurse, a dietitian, the school authorities. You will educate the parents, and any other complications that may occur, and you will involve the people accordingly. So, and social worker as well, and any support groups that you know of. And then you will enlist all the things, like you would say that I would like to I would like to offer him training for monitoring his blood sugar, insulin, that I would decide his insulin regimen according to his age and his routine. And then you will talk about his dietary management, all the activities that he is doing. You will talk about educating them about the sick day management, and about you will try to liaison with the school. And then you will talk about a social worker so that he can help if is any help needed, and you can talk about the support groups if you know, and you will also offer all the literature that the child can read. So the questions that you will be asked in Viva will always stay the same. You should just know how to answer them, and it can only happen with practice. I'd share a scenario, a sample history scenario. So a 14-year-old presents with polydipsia and polyuria. Take a focused history from the mother. Would anyone like to summarize what points you would like to ask? Then we'll just close the session.
So I have a question. Can I ask here or later on?
You can ask.
I want to ask. You told that we have to take this open-ended question. But your all the history points were like we were asking very targeted question, very focused. Like, is he? How is the home environment? What are the like? We should be just be opening the sentence like. Could you
No,
tell about your
we will. Yeah, so for that, we will start with an open-ended question. We will say, tell me about your home and school.
Okay.
Then whatever
So
they
he.
tell, you just have to fill the gaps.
Okay.
Okay, you
So
can
everything
say,
we will be asking like that. Okay,
yes,
tell me about this,
initially,
and then he will guide
yes,
me actually. Okay.
yes. Obviously, you have to use some variety of words. Tell me about this might get very redundant. So, with practice, you can see, okay, can we talk about this? Can you tell me about this? Okay, how about this? So, there are different ways of asking open-ended questions and then fill in the gaps. Most of the times, the role player, as soon as you touch that sentence, like home and school, he will tell you all the relevant things. So sometimes you won't even need to fill the gaps.
Okay. So I have to make it look natural. Like I don't have to like
Yes,
sit. Okay, tell me this. I don't have to do like this.
yes, exactly.
Okay, thank you.
That's very
Thank you.
important. So what are the key points in history? Sorry, I had skipped this. So whenever you're taking a history, you can see that in bold. Everything else we will do, but show empathy and thorough communication skills in this station. So this is the most important do. It's not just it is one of the highest scoring stations because development has a score of 12 and this has a score of 10. So you have to be very empathetic, focus on the systematic approach, sure, and pay attention to the child's growth, nutrition, lifestyle, and development, and demonstrate understanding of complications like DKA and hypoglycemia. Like we said, that we can touch it in our HOPI, we will touch it in past history, and we will also talk about it when we take social history and we are talking about education of the family. So always be very clear. You have 13 minutes. So you have to practice having a pace that is quick, but also clear. It should not look rushed. When you're showing empathy, your expressions should be when the mother is saying that I'm very worried, you should also say, I can understand that you're going through this. So can you tell me in detail what actually worries you? So you see, it's the same question, it's just put a little differently. So this is all about taking a history, and take home message would be always practice. There is just no shortcut. Practice with people who have given the exam before, practice with people who are yet to give the exam. Your peers are your best judges, and your peers are going to be much more strict as compared to the actual examiner. So just read up on the guidelines, but all these stations they take a lot of practice. So try doing that. And the house is open for questions now. Can you, if anyone has any questions? Okay, I guess there are no questions. So thank you so much for your time. We'll be winding up now. And see you in the course, inshallah. whoever will be joining. I hope it's useful for you. Thank you.
Thank you. Allah Hafiz.
Allah Hafiz.